My guy, if people they dodge you, you they talk, they give you backslide. Nobody say they wear sororo perfume. Say they not like the perfume. It might just be because of bad breath. Let's talk about it. Let's go there. 90% of the causes of bad breath are actually present in the mouth. You see, the other 10% is outside the mouth. And I will explain. Have you ever done scaling and polishing? There are some of you, I'm looking at you in 5D.
If you want to talk to me direct, don't go through the corners.
You have never visited a dentist. You have never gone there to wash your mouth. You think you are winning an award. Clap for yourself. Do you know that not doing scaling and polishing can actually cause bad breath?
Are you serious?
When we eat, there's always what we call plaque in the mouth. All right? How many of you have woken up in the morning and you use your finger to scrape the surface of your teeth? You'll see this creamish, yellowish stuff on the surface of the teeth. Have you tried smelling it? It smells really, really bad. That's plaque. Now, plaque, when saliva baits it, plaque is actually food remnants, okay, mixed with saliva and then bacteria in the mouth. That's plaque. And everybody has plaque. Doesn't matter who you are. By the time saliva baits the plaque now becomes hard. It's firmly attached to the teeth around the gum level. And it can be yellowish, greenish, blackish, depending on how long it has stayed in the mouth. Now, when you have those things, the surfaces is rough. So they tend to accumulate more plaque. And like I said to you at the beginning, plaque smells really bad. So if you've never done scaling and polishing in all your 30-something life, 40-something life, 50-something life, 60-something life, go like that, that can actually be the cause of your bad breath. Yes, you're not doing scaling and polishing. That's one. Secondly, you may have tooth decay. If you have holes in your teeth, which is also called tooth decay, you can be accumulating food. So imagine every time you eat, food gets stuck in those holes that you have in your teeth. They stay there. Imagine having 2 days old food, 3 days old food, 4 days old food in the hole in your teeth. That can be giving you bad breath. So a simple solution to that is you need to visit the dentist so that the dentist can fill up the hole in your tooth with a tooth filling. Because unfortunately, the tooth is not like skin. If you have a hole in your tooth, the hole is there. Until you go to the dentist cleans it out and closes it. And so when you get rid of the holes by doing a tooth filling, you no longer have stagnation areas where food can be gathering and accumulating. That can be giving you bad breath. Toothpick gang people, come closer. Those of you that will go to Basirat, Mama Put, and all the joints you like to go to, and then you now put toothpick in your mouth like as if you have won an award. Well done. Clap for yourself. You're doing well. You see, when you're using all those toothpicks, you are creating problems. You are actually creating what we call pockets. It's not pockets in your shirts and in your trousers. No. These are called periodontal pockets. What do I mean? Ideally, the gums should be tight around the neck of your tooth. But when you now have a space between your gum and your tooth, and food is packing in there, you know what I'm talking about now. When you go and eat meat and fish, and that's why you're using the toothpick now, toothpick gang people. You understand what I'm saying? Then you're using the toothpick to dig, like as if you're digging a grave. What you're doing is that you're making those spaces or the perio pockets deeper. So if you were having small pieces of food packing in there, when you're using your toothpick, you'll now be having large chunk of food packing in there. And then don't forget that when you have these pockets, food is in there. No matter how well you brush, your brush can't bring out the food in those pockets. So if you don't clean or take out the food packed in there properly, that can also give you bad breath. Of course, periodontal pockets come with a whole lot of other things. Bleeding gums, okay? Apart from the food stagnating there, decaying and smelling, those things can give you bad breath, okay? So those are some of the causes. Amongst many other causes, gingivitis. Poor oral hygiene. Some of you don't brush well in the morning. You wake up, you're in a hurry. Oh, we have to get to work, and you do your teeth, you rinse like a gogoro to the gods in the morning, and you're on your way. If you don't brush properly, and you're not maintaining good oral hygiene, you are calling a mini gingivitis.
I know here you were.
Yes, gum disease. So your gums are swollen, they are red, they are bleeding. Those things, if not properly treated and managed, can also give you bad breath. And then back to the brushing. A lot of people don't brush their tongues. The tongue is like a towel, okay? And then let me let you know that those microorganisms that cause bad breath, they actually stay at the back of the tongue. So like I've said, when you're brushing your teeth, please don't forget to brush your tongue. A lot of people don't brush their tongue. So what you need to do is stick out your tongue like this, like bingo on a hot day. Take your brush to the back and brush gently from the back to the front. Because when you don't brush your tongue, you leave remnants of food there, and then the bacteria that I said that are mainly present at the back of the tongue that causes bad breath can give you bad breath. So if you begin to brush your tongue, a simple lifestyle change and incorporating that into your brushing can help to eliminate bad breath. Now, some people will say, Doctor, I brush morning and night, and I even brush my tongue, but I still have bad breath. What could be the cause? Come closer. If you have gone to the dentist and the dentist has looked into your mouth and has ensured that you don't have these things and even more that could be causing bad breath, then the bad breath may not be from your mouth. It can be from outside the mouth. It can be in your throat. Some people have what we call sinusitis. You have catarrh pouring at the back of your throat. Your nose is not dripping, but the catarrh is pouring at the back of your throat. And you are pulling it. You know the sound you make? I don't want to do it here. You are clearing your throat. That can cause bad breath because the catarrh is pouring into the back of the throat. And trust me, because it's there, it can bring out that oozing smell. It can cause bad breath. If you have a throat infection, in the throat, there's something we call tonsils. They're by the side of the throat. If they are infected, they are swollen, and there's infection there, the smell can be coming from there. So that's why I said 90% is within your mouth. But if we have looked within your mouth and we have eliminated all the things that could be causing bad breath in your mouth, remember that there are other things, then we'll look beyond the mouth. It could be coming from your throat. It could also be coming from the chest. Don't forget that the mouth is a doorway or a mirror to the body. Everything is connected. If you have a chest infection, that smell can be coming from way down there. It can be coming from your gut. Maybe you have an ulcer that is not well managed. You're belching, reflux, you're having indigestion. All those things can be coming. The smell can be from your gut. So in that case, the first place to come to is to come and see the dentist. Because like I said, 90% of the causes of bad breath is actually in your mouth. And then by the time the dentist checks and sees that the cause is not in your mouth, we can then pinpoint and eliminate what could actually be the cause so that we can get rid of your bad breath. Okay? And then for some other people, the bad breath is in your mind.
I know here you were.
In your mind, you feel like your mouth is smelling. That one is called psychological bad breath. It will also take the dentist assessing you to actually discover or determine whether you truly have bad breath or you think you have bad breath, but you don't. Now, some other people will say, oh, doc, the bad breath is maybe in the morning I've brushed, then maybe when I'm at work, sometime during the day, my mouth begins to smell. There are other things that could be causing it. You may be having dry mouth. Dry mouth can also cause bad breath. Do you do jobs where you are constantly on the computer? You are typing away, screen time. Have you stopped to take a sip of water? You know, when your mouth is closed for a very long time, you can actually have bad breath. So you need to pause, take a break, sip some water, because dry mouth can cause bad breath. There are so many other harmful things that you may be doing. Some people will say, oh, can I use mouthwash instead of brushing my teeth? My answer is fa. No, you cannot. Some of you, in the mouthwash gang, come closer. Do you know that some mouthwashes contain alcohol? And alcohol can dry the mouth. So if you have no business using mouthwash, why are you using it? You are the one creating your own problem, because by the time your mouth is dry, you'll end up having bad breath, because you see, the saliva plays a protective role in the mouth. When the saliva baits the gums, the teeth, it protects the teeth from decay. It also hydrates the mouth, because if the mouth is dry, you will have bad breath. So there are so many things that could be causing this bad breath. But the first place, like I said, to start is to come and see the dentist. When you see the dentist will tell you more. My name is Dr. Joan Kenan. If you found this video helpful, please subscribe, like, and share. Drop a comment in the comment section. I'll be there with you. The dentist is your friend. Thank you.